Sleep apnea involves the collapsing of the throat during sleep. It manifests as loud snoring, or even, people may notice that an individual actually stop breathing during their sleep. And when this happens many times per hour, say 15 or more times per hour of sleep, we consider that to be moderate to severe sleep disorder breathing or sleep apnea. And we were interested in looking at whether older women with sleep apnea have a higher risk of developing problems with mental function or cognitive impairment over time. So these women were relatively healthy and cognitively normal when they entered into the study. And then we measured their sleep using overnight sleep studies to detect sleep apnea. We then brought the women back 5 years later to look at their mental function, and we performed tests of memory, concentration, and attention. And we determined which of the women showed signs of mild cognitive impairment or dementia. And what we found was that those women who had sleep apnea initially, moderate to severe, so 15 or more events per hour, had nearly a doubling of the risk of developing cognitive impairment over the 5-year follow-up period. Well, two things happen when these events occur. So one thing that happens is that the individual usually wakes up. So the sleep becomes very fragmented if they do this several times per hour. And they may wake up only briefly, or it may keep them awake for a longer period of time. So sleep fragmentation, we've seen, can have negative impact on daily function as well as potentially health outcomes. And the other thing that happens is that the blood oxygen levels drop. That's a condition we call hypoxia. And the brain needs oxygen to function normally. So we think that these periodic drops in oxygen levels may also be a problem long-term for health.